But we start with the chair of the editorial board here. He is Diederik Gommers, and if you are Dutch, he became famous during the COVID period. I can't help it for you, Diederik. Diederik, come on stage, please. I thought Diederik Gommers, ladies and gentlemen, of the University Medical Center of Rotterdam, Erasmus MC, head of the ECU. And Diederik, I saw you all 3 days here, walking around, chatting, listening. If I say, catch it in one word, what will be your answer?
That everybody wants...
I said one word.
Oh, one word is working together.
Okay. I'm very curious how you work together in the Erasmus.
Okay, good morning. I am chairman of the intensive care unit in Erasmus University, and I like to share with you what we are doing in our hospital, but our goals, how important they are. But I was really impressed about this interview last year by Marjan Kaljau. She said, the future of our healthcare system is in danger. Continuing doing everything we do now is no longer possible. Healthcare must change radically. And to maintain accessibility, strong choices have to be made. And that is really important, because this last sentence, this accessibility, that's an important issue. And therefore we have a great transition also in healthcare. And that was also the main message yesterday of Ellen Labrick, the director of the WHO for Innovation and ICT, where he said, okay, the accessibility of healthcare is necessary for everybody on Earth. But what then is really important is that we share the knowledge, that we have this kind of congresses where we can say, okay, how can we help each other? What we are doing in the Netherlands, maybe we can also help people in India. But I was really impressed how many people and the introduction of ICT in India, because their numbers are tremendously. And that is also what we see here. My clicker is not working. Yeah. What we see here, the shortage of healthcare workers, and especially the nurses. Bianca Buurman the last speaker will go on that topic. But what we see now in the Netherlands, that we have a shortage of around 50,000 people, and this will increase within the 6-7 years to 140,000, 150,000. And that's enormously. Thus, we should do our work in a totally different way. What we also learned from the pandemic was the stress by our healthcare workers. And what here are two statements, working hard for something that does interest us is that we call passion, and working hard for something that doesn't interest us is called stress. But the motivations of nurses, the intrinsic motivation is very high. Thus, we haven't arranged the way how they had to work, but not only the nurses, but also for the doctors, so we should help them. So what the main issue is that we should focus on improving the job satisfaction of our healthcare professionals. That is the real goal for within the next years. And we see that they have a lot of stress, and you see now also in the Erasmus, but all other hospitals, we start a different project where we work on the career, but also the profession of these nurses, and that they are more involved in leadership and sitting on the right tables. But Bianca will come on that, I'm sure. And what we learned also, and what we have seen already in this Congress in the last 2 days, that there is an immense improvement. These large language models, speech-to-text models, they really could help us to lower the administration burden. And I really believe in this. I think what you can see in all figures, that 60–70% of our time we are doing administration. But we like to be in contact with our patients. We should sit near the patient and drink a cup of tea and listen to his story. That is the work, and that is the reason why we become healthcare workers. And nowadays we have spent too much time on administration. Another important issue within the ICU is the enormous alarm. And we have a lot of stress due to alarm and alarm fatigue. So we, together with the industry, make a proposal to the European community and get a grant was supported that we can start how we can solve that. So we are now looking how the different equipment, the different equipment which is on the ICU, how they can communicate with each other. They are working on SDC, where they can say, okay, now we can make agreement how the data is communicating with each other, and that we can work on AI models to lower the amount of alarms, but that the quality is still very high. And why is so important? When you solve this, then you can do it bidirectional. You can then more automation. Why should the nurse go into the box when the saturation is going up, and then they have to go to the ventilator and they have to lower the amount of oxygen? Of course, we can do that automatically, but then it's important that these different equipments can communicate with each other. But you can also help the nurses in a different way. This was a study, an AI model done on the OR in Amsterdam, where they had that very nice publication, where they said maybe we can predict hypotension in the OR 50 minutes on beforehand based on all this data available during an OR. And when you think about that, maybe we can also introduce this in our ICU. Can we help the nurse with all the data we have of our patients, that we can maybe help them, that maybe introduce a traffic light outside the box of an ICU patient? When it's green, this patient is stable, you don't have to go in, and please relax. When it's orange, maybe you should go for it, and when it's red, okay, you have to run. But maybe this helps them that we can shift off, that they, in their head, that they have more in a relaxed state. So that is our challenges. So what we see is that the health demand is increasing, the health professionals are decreasing, and maybe we should introduce more data and technology innovations. And what we see that is when Ernst Kuipers was Prime Minister, that he received a report of GUPTA, where they said there is already so many technology available, and you see that also here. The industry has already so many innovations and technology available. Why is it so difficult to introduce that, implement that in the healthcare systems or in the hospitals of home care situations? And that is also what we see now. There is ideas, we have a lot of sensoring equipment available where we are measuring vital signs and more or less generate a lot of data. We have our mobile phones with a lot of data, but we are also started to do certain treatments at home. And that is also important. And what we did in our department, where we looked for people who are on a home care ventilator, is it really necessary when we started such a treatment that these people come to our ICU? Now we started a project that we can do that start up at their home situations. They have sensors, we can read their CO2, their oxygenation, but we can also see what monitor the equipment, and we can really change the ventilator settings from a distance. So that will help us. But what we see now, most of the time, introduction these kind of systems, and especially when you also introduce a control center, you need more people, and it is expensive. So we have to learn from that. What we have seen, Helen has shown, the CIO of Maastricht University, on the first day that they introduced a control center here where they improved the capacity. That's an important issue. What we learned from the United States, that they have introduced control centers in America. I have to run. What can we do more? Can we also lower the demand? Not only increase the supply, but also lower the demand. And of course, most important thing is the prevention, of course. 70% of the patients on my ICU are above 70 years. And when we can improve their health, then of course we have lower demand of patient care. And that is also what we discussed during the COVID days, the code black situation, that we maybe didn't have enough beds. So we started in our ICU with passende zorg, right care. But when you like to introduce that, it's very difficult to say, okay, this patient, maybe it's not makes no sense to start ICU treatment. But what we learned is that we need more data to make such a prediction models. And then, of course, then the quality of the data is very important. So that's what we introduced, and that we said, okay, maybe we should look together with all partners in the ICU. So we applied for a grant to indicate a federal infrastructure for data of intensive care units in Europe. And this is our team. The principal investigator is Michel van Genderen, and we will start within the next month working on such a system. Last but not least is, of course, the ethical aspects. So we started together with the TU Delft, but also the Erasmus University, the Faculty of Law, and a real ethical AI lab with the experience of Jeroen van der Hoven, and that's what we're working on. So I think we are here together, share our knowledge and learn from each other. And I really like to thank Tom that he took the risk to come to Maastricht, and that we have from a national change over to an international congress. Thank you very much for your attention.
Thank you, Diederik. This will cost a lot of money.
Yeah.
And there's also a cost rise, just because the demand is increasing. So how will you fund this as a hospital?
Now, but you can see there is no solution to say we should only increase the capacity. We should really think in a different way, so the way how we work. But I think we should be stronger at the admission of our hospital, and also for the ICU, that we can say, this makes sense to start this treatment, or this makes no sense. And of course, when you like to decide such an important issue, then you need prediction models, but then the quality of the data is very important. And that is what we are working on now. Because it makes no sense that we say, okay, when the demand is increasing, we will increase the supply, because we have no money anymore, and we have no people.
The ethic part is for what?
Now, of course, it's really important that you can say the trust of all these AI models, and also how you introduce it, implement that on the department, and also will the nurses and the healthcare workers accept these models, then these ethical issues are very important. And of course, most important for the patient himself.
Yeah. I have room for 2 questions. Who wants to give?
There.
Where? Oh, there. Hard to see. Ik hou hem even vast.
Hi, good morning. Hi Diederik, Geneviève Koolhaas. Ik was ooit ANIOS bij jou. I have been resident on your ward for some years ago. Now I'm doctor training to be GP and chair of the Dutch Association of Women Doctors, and I'm working really hard on inclusive care. And we know that algorithms lack some part of the vulnerable patients, patients of color, patients of lower socioeconomic class. So how do you make sure that you enter all data when the algorithm is built and the prediction model is built?
Yeah, a very important topic that you said, and that is also the ethical aspects. Before we introducing such a model on the floor, we have to be sure that the training of that model is that we took every person within it. So this is really important issue. And we see now, and we can't afford mistakes in medical healthcare. We have seen that in other government institutes, but we can't afford that in healthcare. So this is a really important issue.
Okay. Other questions? I don't miss anybody? No? Then I thank you. Oh, yeah, sorry. Can you come here, please? I will hold him.
Thanks. A quick one. I want to zoom in on the accepting part and change management for the nurses. Can you give us an example what you did to transform the mindset of your nurses?
Yeah, that's a very nice point, because it's really important that you don't, as management team, decided which AI model should be introduced on the floor. So what we first started is that we have meetings together with the nurse and ask them when we like to optimize our way of how we give our care, what do you need? And then we had these sessions, and there were some topics where we started with. So we started now building dashboarding to get an overview of the patients, where they are responsible and where most important data is on the screen. And that was not our idea as medical doctors and innovators that we should start with that, but that was their demand. And now we have the next step. So we are doing it together with the nurses and ask what they need for their daily practice.
Include them in the development.
Yeah, that's very important.
Thank you so much, Diederik Gommers, dames en heren.